Hi, I'm Dr. Sara Wasserbauer, and today we're going to answer a very common question. How come most hair transplants are not as dense as the hair that you're born with? And a lot of this has to do with how hair develops in the first place. So when hair is actually put there on your head by God, you end up with the cells very close together, and so they can develop very close together. And they're like these green onions. Remember, a follicular unit is between 1, 2, 3, or 4 hairs per graft. A graft is a follicular unit. And they're a lot like these green onions, which I found this lovely photo on the internet. They are all bunched together, and when they grow, they can look extremely dense, like this. So when you're growing hair that is naturally there, it looks really close together and very dense. But when I transplant a hair, what I get to transplant is more like this. So I have to take the green onion with its root structure, with some supporting tissue like the fat around it, with the sebaceous gland, which is the oil gland, with all of the little things that come with a natural hair. So it comes kind of like a candle with a little bit of cake around it, or the tree with its root ball. So you have to actually take all of these things, and because of that, I can only get the hairs so close together. As a matter of fact, one of the ways that I tell if it's too close together is if I put one hair in one incision that I've made, and I put the next one in, and the first one slips out. So we make them as close as the tissue will possibly let us, but of course it's not usually as close as what they were, God put there in the first place. So what we do for that is we'll put all of those hairs in as close as we possibly can, and then we'll go back in on a second surgery and add hairs in between to achieve that kind of physiologic density. I always like to say, I'm a goddess, but I'm not God.